Well, good morning, everyone. I think we're going to get started. I know some more people will be joining us, and Alex will be letting them into the presentation. But I'm Jonathan Rondo. I'm President and CEO of the Arc Central Chesapeake Region, and I'd like to welcome you all to our virtual seminar highlighting our most recent report, Workforce Study, Employment for People with Intellectual and Developmental Disabilities and Direct Support Professionals on the Upper Shore. I am so happy that so many of you are able to join us this morning. As you know, the Arc Central Chesapeake Region is a 59-year-old nonprofit supporting people with intellectual and developmental disabilities to live, work, and play in their communities. We were founded in Anne Arundel County, but for over 15 years, we've been providing services on Maryland's Eastern Shore, specifically in the 5 counties we'll be discussing today. 2.5 years ago, the ARC reaffirmed our commitment to the Eastern Shore and began to make strategic investments to deepen our services, including workforce development. Last fall, with the support of the Rural Maryland Council and Jeff Trice, the ARC began a 9-month project on employment opportunities for people with intellectual and developmental disabilities and direct support professionals. The goal of this project was to take a deeper dive into the opportunities and barriers that affect both employment of people with disabilities and their support staff, direct support professionals. Our goal from the inception of this research project was to use it in partnership with the Upper Shore community, including employers, business groups, and other disability service providers. Today, we will share in more detail what opportunities there are for businesses to be more inclusive, diverse, and accessible, strategies for disability providers, and what we've identified employment gaps for direct support professionals. We really appreciate you joining us today. And now I'd like to introduce Christine Larson, our Vice President of Innovation and Improvement.
Thank you, Jonathan. Good morning, everyone, and welcome. I'd like to take a moment to thank the Rural Maryland Council for supporting the grant for this research and for this report that Jeff will be speaking about today. We received funding through the Maryland Agricultural Education and Rural Development Assistance Fund, and I'd like to introduce Charlotte Davis, the Executive Director of Rural Maryland Council, so that she can speak a little about her organization and what they do. Charlotte?
Good morning, everybody. So I'm Charlotte Davis. I'm the Executive Director of the Rural Maryland Council. For those of you who don't know who we are, we're an independent state agency located in the Maryland Department of Agriculture. Our mission is to convene stakeholders, federal, state, elected, private stakeholders to identify the challenges in rural areas. We administer 2 grant programs, the Rural Maryland Prosperity Investment Fund, and as well as the Maryland Agricultural Education and Rural Development Assistance Fund. We call it MAERDAF by the acronym. It's a mouthful to say. So MAERDAF was created in 2001 to support rural serving nonprofits to build capacity. And we look to be inclusive and diverse in the grants that we support. So we make sure that portion, you'll see they're all over the place. We fund things from ag education to studies like this, to feasibility studies, and a number of community development projects across the state, primarily focused on our rural areas. And so we were excited to get this one. We had supported some of our local serving, supported employment programs, and knew that the federal change had really done a number for those, and knew that you all needed help in finding out, planning for the future and figuring out how to make sure that everybody is being served and that they're all participating in society like we want them to. So we were definitely excited to see this program, happy to support it, and I'm looking forward to hearing the results. And I'm happy to stick around for questions later.
Thank you, Charlotte. And for just a few housekeeping items, we are recording this session, and we will make the recording and the slides available after today's webinar. And we encourage this chat and discussion. Please feel free to submit any questions you have about the report during the presentation into the chat box. We will address them during the Q&A session. You are all going to be on mute, and we just ask that during the Q&A, please feel free to chime in with your organization's own experience in any area, and we look forward to speaking further all about this. To introduce Jeff Trice, who will be presenting to us today and led this report. Jeff Trice Consulting takes a holistic approach to helping organizations and people achieve their optimum results by thinking differently and looking at things from a new perspective and having conversations. He's passionate about finding opportunities that lie within challenges, exploring what's true, and breaking barriers to achieve successful outcomes. Jeff is a graduate of the University of Maryland at College Park with a degree in marketing and business administration, and also a US Navy veteran. He previously served as Director of Business Solutions for Anne Arundel Workforce Development, Business Services Director for the Maryland Department of Labor, and most recently as the Economic Development Director for Dorchester County in Maryland. Jeff's background in these areas have allowed him to help organizations create measurable real-world change and achieve better outcomes and make critical decisions when facing defining moments. Thank you, Jeff, for joining us today and for your hard work on this project, and I'll turn the presentation over to you.
Thanks so much, I appreciate it. And thanks to Charlotte as well. So this study, as everyone has said, it was a study that was conducted in coordination with the Arc and funded with Rural Maryland Council, and then I actually executed the project. Very short project, but learned a lot in a short period of time. Alex, you can go to the next. So for anyone that doesn't know what the Upper Shore is, the Upper Shore consists of 5 counties. Talbot County, Kent, Queen Anne's, Caroline, and Dorchester counties. So the study includes all of those. We looked at employment for opportunities for people with intellectual developmental disabilities, and looking at the employment gaps in the direct support professionals. Primarily, those were the 2 things that we were looking at. We did broaden a little bit into disabilities in general. So you'll see a little bit in the report that actually encompasses both of those things. Partly because I think we need to see a bigger view. And the other part is a lot of the data that's available doesn't necessarily break everything down into intellectual developmental disabilities. Primarily because cognitive disabilities, there's a large category. So a lot of the data is compiled collectively. So you're not able to break it apart. So that's part of the reason. It also gives us a little bit broader view into the area. So when we get into the scope of the study, one of the things we did is to make sure, and you'll see in the report, in the very beginning portions of the report, there's a lot of understanding the shore and rural communities, primarily here on the Eastern Shore. But it's not exclusive to the Eastern Shore, even though the report is. A lot of the data and reporting will be effective for any rural area, not just the Eastern Shore. So one of the things before you can start any project is knowing where you are before you can go forward as to what you want to be and what you are looking at. So we had to create some sort of perspective around when you're looking at information regarding disabilities, how does that relate to employment, workforce issues in general. So if we can go to the next slide, please. So the way this was done was over the period of time we had, we did listening sessions. There was a listening session in each of the 5 counties. We did interviews. I had questionnaires that we actually did those in person because of the time constraints. We needed to capture as much information as we could in the shortest period of time versus sending out surveys, which can also limit the amount of information you get and sometimes the quality, because it's easy to steer the conversation and the results, because the way you word the questions, you can actually limit those results. So there was attending some conferences, meetings, extensive online investigation, because this project actually started in the fall, and we were headed into the holidays. So it was going to be harder to gather some of that information because we were going right into the holidays. All of this, actually, the good thing is it all happened prior to COVID. So we were able to capture all of this data prior to. During the project, I was in contact with approximately 300, I think it was like 289 different people. There were 27 businesses, or 53 businesses, I'm sorry, 27 agency staff, and about 180 community stakeholders. So some of those were elected officials, just conversations that I had, and brought a real awareness to this project, and conversations that got started from this. So that's actually one of the results. We did do a SWOT analysis. We did one prior to, and then as the results came, we went back to that same SWOT and put information back into the SWOT that came out of the report. And then, as you'll see in the report, if you have, for those of you who've read it or those who haven't, it is a fairly comprehensive report. We have a summary of the findings and proposed recommendations and some strategies. And we'll go into some of those as we move forward through this presentation. Next slide. So looking at this pre-COVID, all the results that you're going to see as far as recommendations, strategies, those will still apply post-COVID. Some things have changed since COVID happened, but since all the research was done prior to, it's still very relevant and will be relevant. But some of those things have changed with COVID. But at the writing of the report, COVID had started to happen. So I felt imperative that I include that in the report, and thought it might be a bit negligent on my part if I didn't address some of those. So we will talk about that near the end of this presentation, but it is addressed periodically in the report, and hopefully we'll get to talk about some of those things at the end in the questions and answers. But overall, getting this picture of what the shore is, we went into things like, overall there was low unemployment prior to, and there has been a declining participation rate in the labor force. This information comes from the Department of Labor, from the local Workforce Development Board. We can see that that was the way things were trending, and there in the report you'll see there's a trend line that shows in all 5 counties that it was trending down, and then that all changed when COVID happened. Unemployment and poverty rates generally higher for people with disabilities. This is one of the things that you will see in rural. You do see it in the shore, is the poverty rates is something to keep in mind and take a look at. Especially when we get to the DSP portion, but just in general, because it has to do with wages and salaries and those kinds of things. The average commuting pattern, this is something when I was in workforce development and in economic development as well, but primarily in workforce. You look at the commuting patterns, because the idea is you're getting closer to full employment in an area when your commute patterns decrease. So it's one of those indicators that you can always watch and see if it's moving further out, because people only drive as far as they need to drive to get the type of work and the income that they need. So when you see those patterns go down, you know that you're reaching full employment or closer to full employment. So the average commute patterns, a low here is 26.4 minutes and a high of 37 minutes. We do have a lot of people leaving the shore for higher paying jobs and going across the Bay Bridge and working on the other side to get those higher paying jobs. Not that they don't exist here, but there are fewer of them here. Average commute patterns, when we look at it statewide, the average commute pattern is about 30 miles. In rural areas, it tends to be closer to 40 miles. and the report actually shows you that. On the rural areas, you have limited public transportation, and the 4 top industries that are offering employment in the area are healthcare, other than government, which is always one of the top ones. Healthcare, hospitality, retail, and manufacturing, which is where you see many of the jobs are offered, especially within the disabilities community. They fall into some of those categories. Next slide, please. So there were 5 key findings that came out of the report. There's a lot more that you'll see in there, but these are the 5 key findings. The first one is the challenges are not unique, entirely unique. There's always a perception that rural is different and a lot different, and there are some things that are different, but many times they're kind of the same. They might be amplified in one way or another, but they're very similar in the workforce world. Data is in short supply. Actually, this past year is the first year that they've actually captured any rural data. There's data available mostly at national, sometimes state levels. It doesn't drill down deeper into the counties, but we're starting to see that. And we'll talk about that a little more. We'll talk about each one of these findings as we go through the presentation. The untapped potential of the disability IDD workforce, and then the opportunity to create a narrative around diversity and inclusion. This gets into messaging, marketing, the perception of who we are and what we do. And then the 5th one is the disabilities. And the fact that I will say, because of what's going on in the current situation, essential has become a word that we're starting to hear. We heard it a little bit before, but it's a word that really, when you look at DSPs, it's something that's come to the forefront, and I think it's something that we can use to our advantage as a talking point. And then the fact that there's been a general undervaluing of those people. So if we can go to the next slide, please. So when we get into the part about where it's not entirely unique, you can see there that the workforce challenges faced by this is not completely different. Many of the challenges and findings in the recommendation study mirror those of the workforce at large. And these are just 4 of the main things that kind of came out in the report, but there's the same things that we've seen in workforce development for years. Transportation and geographical distance, that particularly the geographic and transportation are mainly issues in rural, but they are also issues in urban as well. Access to technology, that can be either. We do see it a little more here. Online applications, that's been a problem for workforce in general, because if you look at workforce and how funding flows and what people can do, like the workforce developments, let's just take that for instance, and you look at that and say, how do you use the money, who do you serve? You're getting a range of clients, but you're working with individuals that have been unemployed for a while, they're seeking employment. They may not have done skills improvement during that process. So they're still struggling with online applications the same as the disability community struggles with those. Job requirements and job descriptions and skills matching. We had this during the study, but we've also known this from workforce for some time. It was nice to actually have some businesses, some HR professionals confirm what we've heard and kind of thought for a while, is that many of the job descriptions are 20 or 30 years old. So they are not relevant to the jobs. They certainly are not, when you look at online applications, some people are not tech savvy, they haven't kept up with those things. So when you look at disabilities or you look at people who don't have disabilities, many of them are struggling with those same online applications and this skills gap between what the job is saying and what they want. And then when you talk to the businesses, many times the job description does not actually match what the business is actually looking for. So those things need to be updated. So I think there's an opportunity there. So we can go to the next slide, please. Okay, data in short supply. So we have the recommendation there on the side, and I tried to give you the strategies alongside, so it made it a little more efficient for you to see both things together. But gathering and utilizing the rural data is a necessary tool. It's nice to see that it's finally being captured. One of the challenges that we ran into that is that everyone is collecting their data separately. It isn't going into a central repository, so the data can be used collectively, especially in a rural area. Even getting it to the people who are actually collecting the rural data at a national level, it's important that they get the information so they can put those data points in so everyone can use it. But in a rural area, it's important because when everybody goes out and they're looking for funding, grants, those types of things, we don't always have the data to support what it is that you're trying to say that you need the money for. And the more that you can get those things, that information and that data to support the strategies, techniques, the better off everyone is. So if we take this and look at the strategy and look at collecting and sharing more of that data, collecting it better, collecting it in kind of the same way, because then it's improved in terms of putting the data together in a cohesive way that everyone can use it. But if this repository is one of those ways. Next slide, please. We get into the untapped potential of the individuals with IDD. What we found in this is that there's a lot of people that have been overlooked for years and years and years. I think most people know someone who has some sort of a disability, especially as we all age. More and more accommodations, those types of things, but it's been completely overlooked. And during this project, one of the things we found, like when I had an interview with one of the parents, we found out from the parent that their child is actually really good at working for a 4-hour work period. That's when they're most productive. And the parent even admitted that after 4 hours, productivity starts to wane a little bit. They lose a little interest. They start to get tired. So that made me think more about how do we utilize those individuals in a way and match. Everybody gets a better match. The employer, the business, and the individual become a happier, cohesive unit because each person is happy. So I use the idea of things like a bakery, and you say that, if I'm baking bread, I need someone for a 4-hour window in the beginning of that shift to actually help make the bread. And then when I open the store, I might need somebody in that 4-hour period to wait on customers, those types of things. So generally in food services and things like that, sometimes in cleaning services, where many people with IDD are actually being placed, this is a way to say, this person can be really productive and happy, and the business can be productive because they're already doing 4-hour shifts anyway. Most of the employees are not in those environments, are not necessarily full-time employees, and they're using in 4-hour shifts anyway, so why not use people from a different community? Because we hear from businesses, and part of the thing I think that started this project was hearing from businesses, and I've heard it in business services pretty much ever since I got into it, that I can't find workers. And this is one of those that people have been completely overlooked, and the stereo and stigma that goes along, stereotypes and stigma that go along with those things. So when we get into the strategies, we look at communicating the benefits of employing the individuals or the person with an IDD, how the value that they bring. If we really start talking about value of the individuals, and then offering the value-added services to the businesses. So part of that is the discussion that a business-facing staff person might have with a business about matching these skills and abilities, collaborating with that employer to develop a process. So one of the things that came out of this that I learned a lot about, and from a neurodiversity conference and some other engagements with businesses, is explaining the fact that if you break the task down, you can't give 5 tasks at one time necessarily, because the person could get confused and not know where to go, or get upset because they hadn't completed the first task. But if you broke the task down and you said, this is the task I need you to do, and then when you're finished, come see me, it becomes less stressful for the individual and more productive for the business. And if finding out that that actually increases that sort of process from a manager's perspective or a business perspective, actually creates a better work environment and more productivity across the board, even for those individuals without disabilities. Next slide, please. So when we go to this one, it's changing the engagement of business engagement. So this model of business engagement is one kind of started with the switch from WIA to WIOA for the Workforce Innovation Act to the Workforce Innovation Opportunity Act. When it made that change, there was a shift in trying to get workforce development to look at things from a business perspective first, and doing demand-driven, business-focused mindset, where before that in WIA, it was all about putting the individual first and then the business part coming second. So this is part of that sort of a strategy with regards to business engagement. The strategies with regards to staff is making sure that that you're training your business-facing staff. What I noticed in talking to many of the agencies is some of them had some business-facing staff to try to get an individual employed. Some of that was being done by the direct support professionals. Some of that was being done by administration. Some didn't have like a dedicated staff person or staff to engage businesses on a regular basis. So the more that you can get to the idea of the community at large, the disability providers, having that sort of engagement where everybody's talking kind of the same language, marketing the abilities versus the disabilities, because what I see and heard for years and years on the business side of it is someone would always lead with the disability instead of leading with the ability. And systematically, we've kind of taught the individuals and I would say DSPs to do the same thing, because many of our funding streams are tied to the disability, not to the ability. So if people know that that's how the funds come and how they access those, even though we're trying to remove those, we end up actually using those labels when we're asking everybody to take the labels away. So it just helps change that, and changing that view and that vocabulary often changes the way in which we actually engage the businesses and talk about what somebody can actually do. When it says avoid convening, that's regarding convening businesses. I actually did a summit several years back when I worked in workforce development for the state, for the Department of Labor Relations and Regulation. We convened 100 different organizations, individuals that employ people. We found out that there were over 300 agencies that actually were calling on those 100 businesses to try to get individuals employed. And from that, there was a term that we came up with as employer fatigue, which they said, one of the companies actually said they had to hire someone just to take care of meeting the people that came and knocked on their doors. That's how bad it was. So the businesses are not just sitting there waiting to be convened to try to get input. And when they have, they get frustrated because people listen and then they don't necessarily use all of those things. So building those relationships and are more important. So if you can get to this part where we talk about identifying the needs of businesses and becoming a trusted resource, that's that relationship piece that makes it much easier to make those connections and collaborate. So we collaborate across agencies. One of the things that you'll see in the report is that when you're looking at placing someone with a business. So we engage a business and they tell us that they need workers. And they say, you know what, I need 20 workers. And your agency happens to be one that has 20 workers in an area, but only 3 of them are actually seeking employment because the other 17 are actually employed. So you can't necessarily meet the needs of that business by yourself. But if you could collaborate with other agencies in the region and meet those needs of the business, then everyone wins in that situation. When we get into things like identifying emerging and sustainable markets, there's a lot going on right now with different food industries. When we talk about climate change and what's going on with environmental and flooding and flood mitigation, there's a lot of areas that we haven't necessarily looked at that could be new sustainable type of employment for the disability community, just that moves away from those food service, cleaning service, those types of jobs, and actually could get into a little bit higher paying positions as well. So the other part of this is celebrating success and sharing those stories broadly. I think it's something that you might do internally. It doesn't always get to the public at large. So those are areas that we can work on. Next slide, please. So this gets into that piece that we were just talking about with the narrative about diversity and inclusion. The messaging and marketing needs to be more consistent and unified and positive messaging. And then the workforce practices to serve the needs of the individuals with IDD is speaking the language of business to be relevant to business. So those are things like talking about things like return on investment and understanding those things. I know this isn't like person first, it's the business first portion of it. So if we speak in those languages, but one of the things we ran into in this study is, I think there were 8 different terms being used by the agencies in the 5 counties to identify the individuals, the clients, whatever you wanted to use for the person that you were working with as an agency. And there were something like 7 different terms used for the business facing staff. So that gets really confusing for the business, as well as agency to agency, or just having a general conversation to the public. Because when I engaged and we talked about it, sometimes you had to clarify what those things were. So someone was like, oh, okay, I got it now. So this last one about being present in the business community and having a seat at the workforce table is a lot of times what we saw during the report was that sometimes when you had DSPs, because you were very shorthanded due to funding or whatever, if someone called out, that load got shifted to other DSPs, or administrative staff was doing that. So because that's been happening for some period of time, the administrative staff that would normally be engaging or going out to events were kind of locked into being within the organization, staying at the company or organization's headquarters and not being in the community. So they're left out of that conversation. They're not engaged, and people forget about you. One of the agencies said they'd been in business for 50 years, and I asked that question, do people know who you are and what you do? And the answer was, no, not really. So here it is, you've been around 50 years and you're still finding that you have to fight this battle every day. The other piece is making sure you get a seat at the workforce table. I've been in many of those meetings at the workforce levels. During WIOA, we saw a transition where Doors, Repay, and some other agencies were able to get to the table, but that's maybe the one agency that had that voice to speak for the disability community at those tables. So I would encourage everybody to try to find a way to get into your local workforce investment boards and sit on those boards, or to be engaged in the conversations wherever you can to be able to move that conversation forward. Next slide, please. So now the DSPs and the essential worker piece. If you look at the diagram that's on the left side of that screen, you'll see those are all tasks that a DSP is asked to do. So sometimes that is being a counselor, a driver, a teacher, a psychologist, a nurse, because you're administering or overseeing the administering of medications, those types of things. And then you're asking all of that, but we're paying them. If you look at the center diagram, you'll see that the average is $11.74 on the upper shore is the average wage. National average is $11.38 is the wage for that. And I did, on the chart that's in the report and it's in that centerpiece, is you'll see that I picked wherever there was a service provider in each of the 5 counties, there is a wage for DSPs, average wage for each of those counties, so that you could get a real picture of what that looks like. Now, sadly, across this, you'll see that this lack of wage growth that's adjusted for inflation, that over a 10-year period, that has only moved 45 cents per hour. There's another one in the chart that's there that shows that someone that's less than a year to someone that's 20 years plus, there's only $1.40 wage difference between the person that's below a year or less to someone that's been in a DSP for 20 or more years is only $1.40. So those are the things we need to be concerned about. And it's also why you have some of the gaps that exist. Next slide, please. So this pay and compensation is part of that. So you need to look at creating a culture that values the DSPs, and addressing the pay issues is the #1 concern. It came out from like every DSP that I interviewed, all the agencies, they know that it's part of the challenge is the wage. And part of that comes from this next piece where it talks about building the career opportunities and looking at this holistically. But part of the challenge that and it was expressed by the DSPs as well, is that there is no standard occupational code for direct service professional. We have for CNA, GNAs, so there's no data that's being collected for direct service professionals, but there is for CNA, GNAs. You have people that can actually go to Congress or DC or policy and argue for wages and things like that. The biggest thing is there's really no data being collected, so there's nothing that you can use to strengthen your case to be able to negotiate for some of these things. So the career pathways, we did hear from some of the DSPs that they would love the opportunity to be able to go and grow within the agencies and move up the ladder. That hasn't necessarily been the case, that people can move up. So it's been a little bit stifled there, and that gives them an opportunity to see some wage growth as well. So that's something that can be worked on, but part of that starts with this occupational code as well, and then training. Taking this holistic approach to the management piece, when we look at refining this attraction, acquisition, retention efforts, and the transitioning, one of the things that came out during the report as well was this concern that when there's a lot of turnover in DSPs, especially with individuals with IDD, they get upset, and there's an adjustment period between why did someone leave, is it me kind of a feeling, and then because that person becomes very close to them and kind of family, looking out for their interests in so many ways. And the person that's the DSP also feels that way, but if they leave, then that person often feels abandoned. And then there's an adjustment period to get them so that they're comfortable again, and then that can interrupt the work cycle for the individual that's trying to find employment, but just even general care of that individual. So if we look at those things and look at transition, even if someone is like reaching retirement age, if they're moving out of the system that way, this is something to think about. The other thing I found interesting and concerning that almost every DSP, whether I talked to them individually across the shore or the research that I found, there was a report, President's Committee for People with Intellectual Disabilities, a report to the president in 2017. I found that after the research was all done, which actually I was happy I found because it actually supports many of the findings so that I had in my report, because I had so little data that was available to me locally to be able to look at it nationally and at a state level to say, are we on the right track or not? There's a lot of information in that report that talks about just this, but finding out that the direct service professionals, many of them are working 2 and 3 jobs to make ends meet. I had one person tell me that they actually had to file bankruptcy because of income. So it's a real concern. In rural, it's a very tight communities. So it's a 2 things to that. One is a very positive, that in a tight community, it makes it easier sometimes to get someone employed because somebody knows somebody and they're willing to give somebody a chance. The other thing is a very tight community. So when bad things get out there and start to spread about work conditions or pay, then that can actually have a negative impact because it doesn't take long for that to spread in the community and make it that much harder to find a workforce. Next slide, please. So how do we adapt to a changing world through the lens of COVID? I think what you see in the bottom there where it says essential, that's a big thing to think about and have a conversation about. We've already seen immediately some numbers go down. It's interesting when it came to unemployment numbers throughout this research that the gap between those without a disability and those with a disability moved together. They always moved together. So whatever that gap was, and you saw unemployment go up or unemployment go down or wages go up or wages go down, they moved together. There was very, very little change in the gap between. They just always moved together. I thought that was interesting, fascinating. So there's been significant impact in the tourism, food and services, and hospitality, because that's where we see most of the individuals that are employed right now are working in those across the Upper Shore region and in rural communities in general. Operations have been altered. We've seen that when COVID happened, businesses shut down, unemployment spiked, and across the nation. We don't know what that looks like, but this redefining of what essential is and the importance of essential, all of a sudden, when we talk about reopening, essential became something that was now, we needed to get these places open, or we needed them open even when COVID first started. And they're mostly in those industries about food services, Walmarts, places like that. So it's interesting. And then if those are where we're placing people, and then we look at DSPs as being essential because they're the support staff to these individuals. And I heard stories of some of the DSPs that were actually living more in like the group homes or whatever, so they could be closer. And then they were actually giving up time with their own families to be able to spend time with the individual. That's something that landed on my email somewhere along the lines. But I've been getting a lot of this kind of information since this report started. But I would say on the other side of the positive side of COVID is it's given us a time frame where we can actually take a pause, reflect, think about the designing what an inclusive environment workforce would look like. What does it look like with essential workers? And how do we get into this discussion of what's happening socially around what's equitable and inclusive and diverse employment. I think there's a lot of space there for us to have some interesting conversations and to really take the time to redesign. From a business perspective, it seems like everybody's always looking for more time. And COVID has actually given us time to sit down and reevaluate businesses, look at, are those businesses coming back, not coming back? How do we restructure so that we can survive and sustain? When it comes to food services, I will say the restaurant business has been hit hard. Many of those businesses will probably not return. But usually when somebody leaves, another one comes back in, and it'll just be a different kind of food that's being offered. But eventually they come back in, but initially we probably will see that. And most of that's just because those businesses work on very tight margins anyway. So it's not completely unexpected because they're sometimes in a vulnerable position anyway. Next slide, please. So where do we go from here? This is where I hope that we start to get some questions, if we don't have any already, and then we get into the question and answer piece. But this is the thing when we start to get into the dialogue with this diversity, inclusion, equity, and bringing that conversation to the forefront. We look at what's going on with Black Lives Matter, Me Too movement, women's rights, pay inequity, having an inclusive and diverse workforce. What I see a lot of times and have seen is in many organizations, businesses, government, or otherwise, is that the people that are sitting at the table making the decisions are all the agencies that need to be there, are all of the different genres of how we identify people, because we are good at identifying people and putting them into categories. Are those people being represented in your boardrooms? And then, because that changes the conversation about the decisions that you make and the policies that you make. But the question there really is does your boardroom or your organization look like the demographics of the population you serve? Because if it doesn't, then you need to probably make some adjustments in those areas so that you can become a more holistic, more relevant business, and that will allow you to be more sustainable. But then again, this transparent conversations, collaboration across partners, and just building a general awareness. Because I had in Kent County, I had a business that came to me and said that they needed workers for a call center, and it's in the report as well. And when we had the conversation, he needed people that would be able to, that had advanced degrees. And he said he was intrigued by the conversation about disability. And I said, well, you do realize that some people who have disabilities could have an advanced degree. And he said, I never really thought about it. And I never really thought about it that way. And that was a theme that actually went through this entire report, is when I went out and we started talking to people, they were just like, I never really thought about hiring from this community. The other thing that was interesting was talking about spectrum. So one of the first things I did was went to a neurodiversity conference, and one of the things that happened in that was this whole discussion about spectrum. And as I engaged businesses and we took that to the public, this idea of spectrum and disability and workforce and how you might utilize people and engage them into your workforce, that was something that came up. But this thing about spectrum, what I found was it seemed like everyone that I talked to, business-wise, and just individuals, when you talk about somebody with intellectual developmental disabilities, they always went to the lowest end of the spectrum. It didn't matter what the disability was. It was always the lowest end is what the perception in their mind was. It was not about that there was an entire spectrum and that people could meet your needs on all these different levels. So when you get into things like autism and how do we match that, if we have hearing impaired, how do we match that to jobs? So it's interesting, and it'll be interesting to see where we go from here. So that's pretty much what I have.
Great, thank you so much, Jeff. We will now move into our Q&A portion of today's seminar. And just as a reminder, we've got, as part of our Q&A panel specifically, Jonathan Rondo, the President and CEO of the Arc Central Chesapeake Region, Dina Killman, the Arc Central Chesapeake Region's Director of Engagement. She leads our workforce inclusion efforts on the Eastern Shore specifically. Of course, Jeff will be part of our panel, and Charlotte Davis, the Executive Director of Rural Maryland Council, if there's any questions specific to RMC. So I will go ahead and get us started. We can feel free to enter in any of your questions into the chat. You're free to do that to everyone, or send them specifically to myself, Christine Larson, in the chat, and I will be happy to share that with the group. Also, just since this is really meant to be a collaborative and engaging conversation, we encourage anyone listening in and viewing today's session to please feel free to chime in with your experience. If you as either a provider, or I know we've got some folks from the chamber or state entities or other IDD providers are joining us. So feel free to please chime in with your own experience, and we will go ahead and get started. First question for Jeff. While conducting this study, among all of the information presented, what was the #1 thing that stood out to you about the Upper Shore in relation to employment of people with disabilities, and the #1 thing that stood out to you in relation to direct support professionals in the workforce?
Okay, so the spectrum thing was one of those. That was very interesting to me, but this general lack of awareness when it came to disability, and especially IDD, there was just a general, people just weren't thinking about it in any way. So it's part of why I think it's been challenging to think about that. The other part is getting the individuals to think about our communities are made up of everybody. So from an economic development perspective, for instance, we need a diverse and inclusive environment. And more and more, when you look at people that are coming to different areas of the country to live, we have younger people that have said that they're specifically looking for diverse communities and inclusive communities. So it was interesting to see that that wasn't, in fact, what most people had a perception of. I mean, the people were there, they probably know someone, but they weren't necessarily looking at those specific. The other thing from the DSP side of it is, I think I was really shocked to hear about DSPs working 2 and 3 jobs. I hadn't really heard that in like the CNA, GNAs. I mean, I know that sometimes I have heard, my daughter actually is one of those people that went to college and was CNA, GNA while she was in college, moving towards her nursing certifications. So that part of it, so I kind of expected like the 1 job. I was really shocked by the 2 and 3 jobs. And then when some of the DSPs started telling me about what their workday looked like, and if somebody called out and they went from a caseload of 3 or 4 people in a normal caseload to someone called out and I now have their caseload as well, so I have an additional 3 or 4, that adds to the drive time and moving people around and just general taking care of them. and then at the end of their shift, when they get everybody back where they belong, now they're sitting down to do all the reporting that's necessary. So many times it was late into the night to finish the reporting pieces that they needed to do. So that was a new thing for me to learn about that. So the report, I hope everybody else learned a lot. I learned a lot from doing the report. It was very enlightening.
Great. Thank you, Jeff. The next question, many of the challenges outlined in regards to Objective 2, decreasing employment gaps for DSPs on the Upper Shore, are factors external to providers. Aside from advocating for change, what are some examples of what we can do now to recruit and retain DSPs? I think that can be Jeff or Jonathan.
So I'll start. So things that we are doing as here at the ARC, during the study and as a result of the study, is really thinking about our DSPs like we think about the people we support in a holistic manner. And so on the Eastern Shore, we are piloting where our DSPs work in multiple different departments and learn skills in those, whether it's employment or in-home supports or in community living. And then based on their schedule can then work those flexible hours. And so creating, and particularly during COVID, have forced us to do this in some way, but it has created opportunities for people to find balance with their family. And while they might be working another job outside of the ARC, that is one way. And I think we've heard anecdotally from the DSPs that we have that they've appreciated that sort of flexibility and sort of trying different areas, working with different people we support, but also that there's other options if that 8 to 4 Monday through Friday schedule doesn't work for them, or evenings don't work for them, or only works on Tuesdays and Thursdays. So that's been one. And I think the other is, as we think about how we talk about recruitment, is being really honest about what is the role and talking about that. And so the image that Jeff had on one of the slides is the image that we have on our website and we use when we're interviewing direct support professionals. So, because a lot of times, most of our direct support professionals that we hire have limited or no experience with people with disabilities or the field before they come in. And so giving them a clear picture of what the job is. And that becomes more difficult during COVID, where we can't necessarily have them visit a job site where we might have someone working if it's for employment, or visit one of where someone might be living. So I think looking at that and thinking sort of outside the box.
So I can add to that a little bit. There's some information in the report about like the profiles of some of the DSPs in general, about why they came to become DSPs. Some of them have come from family. They've either had a family member that has a disability, or that they've had somebody in the family has been a DSP. So they are some of them have come from that background. But the other piece is making sure that you, I think, look at things like K through 12 and introducing that idea of service and concern for, like, if I was a young person, for instance, and I had a family member or friend that had a disability, I might not even be thinking about working in that field. But if I was introduced to it early enough in K through 12, where I can say, oh, I didn't even know that was a job. So maybe I can think about this as a future. So it's a longer term perspective and view for recruitment of DSPs, but I think there might be an opportunity to take that approach. And the other is getting in the community and just letting people know what it is you do and why you do what you do. Because some people might just say, I never even thought about that as a career, and maybe I should do that. Or even as that second or third job that we've heard people say that they're doing. That could be one of those things. Another piece that came out of some of the reporting is what our future looks like in terms of as we get older, more people self-identifying, the need for DSPs will be increasing. As our population in the United States starts to change and we have more ethnicity, so we're looking at different languages and being able to communicate with the individuals, with the IDD, and the business community in Spanish or whatever the languages happen to be. Having that as part of your workforce will be more and more critical. So if you can start that kind of recruitment now and trying to reach some of that, so that if it does grow as large as they're predicting, you'll be ahead of the game.
Great, thank you. I love this question. So how does technology play a factor in employment for people with disabilities and DSPs as it relates to the current landscape? What considerations do providers, businesses, and other stakeholders need to keep in mind? Let Jeff start.
You want me to start?
Yeah.
Okay, so we talked about online applications. So that's one of those things that, but in rural, there's been a lot of work, and Charlotte knows this too, and pretty much everybody on the shore understands the need for broadband, and we're starting to see some of that. But access to either the computers and or just internet, Wi-Fi connections, those kinds of things, that's becoming more and more critical for everyone, but really more importantly in this world as far as disability community and access for them. Luckily there's the library systems, but not everybody can get to those. But that lack of access to internet, computers, and then they have the abilities to operate that equipment. I think there's an opportunity though there, especially with COVID, to think about, and I know the whole thing that's going on with sheltered workshops is interesting, but then beyond that is there a way that the individual during COVID could possibly work from their group home? And then technology becomes even more important. If you look at, are there things you can do to help a business remotely, just like we're working remotely? They should have that same opportunity to work remotely.
Great, thank you. And Dina, anything to add?
Yeah, I would just like to say that we've proven during COVID that telework is an option. So people with mobility and transportation issues, this shouldn't be a factor. So when we talk about job descriptions changing, being present 9 to 5 at a company, we know that that's not always the case. So we need to educate our employers that during COVID, technology has allowed for many more people to perform many jobs from their home, and it's been very successful. We've got a proven track record this summer. So I just want to remind employers that that has, been a success. And of course, we have our Assistant Director of Workforce Development on the phone here, and she has been working with the people we support all summer very successfully, coaching them virtually. So just want to make sure that everyone knows that this is still going on and we've been doing well.
Great, thank you, Dina. I'll direct this next question to Jonathan and Dina. What are the hopes for the recommendations presented, and what's next, and how can other people or organizations get informed or involved?
So I'll start, and then I'll let Dina pick up from a more sort of hyper local focused perspective. I think for us, we wanted to sort of, like I said from the onset, we wanted to sort of test some of our assumptions by this report. And I think as an organization that serves both sides of the bridge, we anecdotally were seeing that things aren't that different, but as Dina did engagement, people would say that they were. And so we wanted to do some research that looked at what are the sort of regional pieces of the Upper Shore, but also what are some lessons we learned that are effective no matter whether you're in a rural part of Southern Anne Arundel County versus whether you're in on the other side of the bridge. And so I think that that's the piece. But first and foremost, we also wanted the report to be a resource for everyone, which is why when it was completed, we put it out and we want people to utilize it. We want other service providers, and we want it to be a launching pad for further conversation and further conversation regarding that. And so we are beginning to dive deep into those recommendations through both our workforce development program, but also through our people initiative on how we can use the lessons learned in that. And our hope is that other providers will be beginning to do the same, and that we can at some point possibly start a community of practice where that work and dialogue can continue. Because as Jeff said, this isn't an isolated piece. This is not we all have to sort of work in concert for the strategies to be effective.
Mm-hmm. And I will add to that we began doing workshops back in 2018 for employers within the Chambers of Commerce and the Economic Development offices. We do continue to do that. I have one just recently, Kent County. We have noticed that there's a lot of interest around the topic. If you Google diversity, inclusion, and equity, you'll come up with millions of hits. Number one topic on Forbes right now is how do we include this more diverse workforce, and then that includes people with disabilities. And so we are planning to keep doing these talks. I've got one scheduled for Caroline County next week. The Caroline County Chamber of Commerce is having September 22nd, and there's already a couple dozen people registered to listen and learn. And we are hoping just to continue the discussion. So anyone that wants us to reach out to a specific employer or wants a private conversation about where their company may be in this journey, we welcome that reach out, and we will certainly be here to advise you throughout this journey.
Thanks, Dina. And to kind of expand on that, could you share a bit more what your role is on the Eastern Shore as the Director of Engagement with us?
Sure. So one of the things I do is help employers understand who we are and what we do. We educate people on this topic. The topic of inclusion in the workforce is really huge. One of the questions I share with employers is that how many people do they employ with disabilities? And they always go no. And I say, well, you probably have more than you think, because about 16% of the Eastern Shore identifies as someone with a disability. So if you're an employer with 100 people, clearly you are employing people with disabilities, and we want to further educate you. So that's one of the things I do, is reach into those HR departments, reach into those employers, and ask them, how can we assist? How can we help you understand what's going on in your community, and how do you access and make these jobs accessible for people with disabilities? Because we know you have vacancies, so how can we bridge that gap for you? So that's that's one of my primary jobs out here on the Eastern Shore.
Good. Thank you, Dina. Another question here. Based on the study, what appear to be the biggest barriers to inclusive and diverse employment? Jeff, I'll let you start.
Okay, so I would say it was something that existed before, but it actually really exists even more so during COVID, is the challenge that it's not first and foremost in a business's mind. You're starting to see, like Dina said, more and more like Forbes and all these, diversity and inclusion is becoming a hot topic. Sadly, it's very narrow topic often, because they don't get in, often disability is not part of that diversity and inclusion discussion. It tends to be a very short-sighted view of maybe ethnicity or race or gender or something like that, and it doesn't go always a lot broader than that, and disability is often left out of that description. So that's one piece. But I would say during COVID, most of the businesses are more focused on just how do I open, how do I sustain, how do I survive this, So they're not necessarily thinking about it, but because of the social awareness and the things that are going on, there is a window to start having these conversations so that those businesses can be in this planning stage of when I do reopen, what am I going to look like? And I think if you take those things and things that came out of the report combined, I think you can make something great out of that.
I would also add barriers out here are fear. Lack of education on the topic is one of the most basic barriers. The more we can have these discussions and the more we can talk about it, the easier this path will be. We've got plenty of people out here willing to assist the employers. So we've got doors, we've got other service providers, and of course we've got us. So I would say the education barrier and understanding the topic and how we can bridge that gap is the number one thing. Of course, we have transportation issues out here. Of course, we're going to have the rural issues of technology and all those sorts of things. But the more the conversation is opened, the more that we will find success.
I think Dina's right on that. And I would add to that too, just that is what we saw, is that there needs to be more and more. And the beauty of this project is when we engaged and had those conversations, people responded. And it was amazing the response that I got and Dina got, because Dina was there on many of those engagements with the individuals in the listening sessions. But it was nice to see that response. Sad that it had to be that kind of a conversation to get people to realize, but it is that lack of education.
Thank you, Jeff. Thank you, Dina. And to kind of expand upon that, I'd like to direct this question to Jonathan and any other organizations and participants that are on the line here to speak specifically about how the COVID health crisis has impacted employment for people with disabilities. I'll let Jonathan start for how that has impacted us here at the Arc, and then open it up to any other folks on the line who might want to share their experience.
So I think there's sort of a mix, just like in the for people without disabilities, the people we support, some are back working, and they've been working since March in essential jobs, consistently of that. Some keep going back to work, and then their work shuts down due to having a COVID outbreak, and then they quarantine for 2 weeks, go back to work, and it happens again. We've had that for a couple of people we support. And then we have some people whose employers are saying, we've reduced our workforce, but when post-COVID or when we're ready, we want you to come back, which is no different than people without disabilities. And then we have some people with disabilities and their families that are choosing not to go to work because of an underlying health condition. And then, of course, we've had people who've lost jobs. As Jeff talked about, a lot of the people we support and that are people with intellectual and developmental disabilities tend to work in those frontline jobs, whether it's at a restaurant or at a store or something that's been sort of contracted, or they're doing work differently and need less workforce regarding that. But as an organization as a whole, we have about 50 people who are continuing to go to work, many of them in essential jobs in their community. And so I think we're sort of navigating through that. We see our role in helping people if they are laid off or not interested in continuing to work because of COVID in their current thing. It's our job to help them find other employment. And so that's continues to go on. I think COVID has also spurred, like it has for many of us, conversations of, I never really liked that job. Why am I going back? Or this is what I've discovered through some self-discovery that's happened over the last 6 months as people are home more. This is something I want to be more interested in or I want to learn more about. And so we are trying to take those opportunities, seeing those opportunities in this period of challenge wherever we can.
Thanks, Jonathan. Is there anyone else on the line who'd like to share their experience?
I would point out, Jonathan did have a lead into that we've had incredible success stories with people that we support, along with our employment advisors that have worked continually through the pandemic, and the stability of what we do has provided them the opportunity to feel comfortable in those roles. So there has been a lot of success stories.
Anyone else? Good moment.
Hello.
Hi, is this this is Nicole.
Hello, I'm the advocacy specialist for Southern Maryland. Just put a bug in everybody's ear. DDA is looking for stories from self-advocates for, DSP Appreciation Week, which we just had. And so if you have any stories on DSPs, they can write, and stories on working for National Disability Employment Awareness Month, talking about their job, what they like about it and stuff. If you could get stories, send them to me or Patricia Sestoki. That would be greatly appreciated.
Follow us on Facebook, Nicole. We've got DSP Week going strong here, and our success stories have been going all summer long. So get on the Arc Central Chesapeake Region Facebook, and you'll see a story almost every day.
Cool. And if you can get some of those stories, and get them to Patricia, that would be good.
Great. And I see you've also put your phone number in the chat for anybody who would like to reach out to you directly. Thank you, Nicole.
You're welcome.
I'll just take a second and echo what Jonathan said. We've seen a lot of success over here in Kent County. Obviously, a much smaller organization, very small community. And we've had a number of people who have gone to work and come home and then gone back again and then come home because of companies shutting down. We were pretty insulated from the initial impact, but have seen, kind of an uptick here on the shore. I know that we're not the only county seeing that. But again, echoing what he said, there's been a lot of opportunity around strong conversation that we've had with the people that we support around what they want to do. Where they're home and all of a sudden they're realizing that they're kind of dreading going back to that job, which is not atypical for people with or without disabilities, but kind of giving us the opportunity to have them do a little job searching while they have those 2 weeks at home and consider what other options there may be. Of course, that's also a challenge for us because there's limited employment opportunities, and then companies shutting down amid COVID. That has become a little bit of a challenge, but at least we're getting a better picture on where they want to be. And we've done a little bit of, we'll call it traveling, local traveling, of course, not going too far, but a little bit of traveling for potential employment, which has been different for us and something that wasn't really supported in the past.
Thank you, Wes, for sharing. Anyone else like to share?
Hello, everyone. I'm Stephanie Hollowell. I'm an intern with the Division of Rehabilitation Services at Workforce Technology Center in Baltimore, and I'm also the North Dorchester liaison for the Dorchester Chamber, the Young Professionals. Recently, the Dorchester Chamber and the Salisbury Area Chamber of Commerce just had a luncheon conversation on COVID. So reflecting on that, one of the things that came up in terms of the workforce, both people with and without disabilities, was a challenge of they're graduating high school, they don't have a job because of the hiring freeze for the state. So that's impacted a lot of the state jobs who are only hiring internally and not external. And on top of that, they have children that are in school, they're trying to go to college, they play all these roles, and yet that because of the COVID restrictions, they're actually not doing things the way they want to do. It's good now that schools are finally letting gradually small groups come back, which is a good thing. However, we're not, like Dina said, uncertainty of COVID, we're not sure where this is going to land in terms of businesses. Yes, the government's still hiring. At the same time, they're limited on the hiring they're doing right now. So if someone leaves a job, yes, they're going to hire for that particular position. So it's kind of, we're stuck between a rock and a hard place. And we actually had a good conversation about this. So a lot of the topics everyone's bringing up were definitely discussed during this, and we like to have another one. So yeah, we're open to doing something like that. I know the ARC is affiliated with the chamber, so if you guys like to have something like that, just let me know and we can set something up.
Great, thank you so much, Stephanie.
Thank you.
Anyone else on the line like to chime in before we move on? All right. Well, to head us into wrapping up here, again, I'd just like to reiterate that we will be sharing this recording and slides after today's session. The study is available on our website, the arcccr.org. And to just continue, right, this study is really intended to be used as a community resource for everyone, and we will be developing a survey to gather stakeholder input and hope that you all will participate so that we can continue this conversation about workforce inclusion and learn more about the opportunities that exist. Dina Kilman, as you've heard from, is again our Director of Engagement. She's very well versed in the opportunities that exist and the barriers that exist on the Eastern Shore. And if you'd like to schedule a time with Dina to present at your organization or group about workforce inclusion, please, or build awareness, please feel free to reach out to her. I'll have her put her, yep, she already put it, email in the chat box there, dkillman@thearc.org, and she'd be happy to continue this conversation. With that being said, I will pass it back over to Jonathan to wrap us up for today. And thank you again to Charlotte and Jeff for joining us today, and for the funding that Rural Maryland Council did to be able to complete this study. Thank you again.
So, and again, thank you to all of you for participating with us today. I would be remiss if I didn't remind people that it is National Disability Direct Support Professional Recognition Week. And so while we are recognizing our DSPs socially distant, they are an incredible important part of the work we talked about today, and why we wanted them included in the study around that. And again, please reach out to Dina specifically if there's any follow-up or ways that we can help disseminate this information to your community, to your groups. And we really encourage people to utilize this and use it as a launching pad to your own work. So again, thank you, and we hope everyone enjoys the rest of your day.